and thank you for the opportunity to present today. My name is Leila Trummel, and I'm going to be presenting on behalf of the Rwanda Endoscopy Week 8 collaborative team. Our presentation is titled, Expanding Endoscopy Capacity in Rwanda, Outcomes from the 8th Rwanda Endoscopy Week. Rwanda Endoscopy Week, or as I'll be referring to it as REW, is a recurring national initiative focused on strengthening gastrointestinal care through training, service delivery, and partnership. Today, I'll share the outcomes from the 8th iteration of this program and discuss its implications for scalable health system development. Rwanda Endoscopy Week is a collaborative initiative built through local and international partnership, and its goals extend beyond just doing procedures alone. The model is designed around 3 core pillars. First, training, providing hands-on GI and endoscopy education to local physicians, nurses, and staff. Second, access, expanding procedural care to patients in underserved regions who may otherwise face geographic or financial barriers. And finally, and very importantly, sustainability, helping to grow durable in-country workforce capacity and systems infrastructure that exists outside of REW, moving Rwanda toward an independent endoscopy system. REW 8 included 7 hospitals and achieved the highest procedural volume to date, demonstrating continued national growth. Briefly on the methods, we conducted a prospective multi-center observational evaluation using a survey tool made in conjunction with residents at the University of Rwanda to evaluate Endoscopy Week 8. The dates that we conducted our survey were between October 27th and November 7th, 2025, and the data was collected at 7 hospitals throughout Rwanda. These blue dots indicate our participating hospitals, and the variables that we collected include patient demographics, the procedures performed, the indications, the therapeutic intervention, anesthesia utilization, and then also had a place to report follow-up outcomes that were then used by the Rwandan medical residents to follow up on important findings such as H. pylori eradication or large masses, things like that. And this design allowed us to both assess clinical output and systems level expansion during the initiative. So excitingly, and as mentioned, Rwanda Endoscopy Week 8 had the highest procedural volume in program history, where we conducted 1,158 total procedures. The majority of procedures, 87%, were EGDs, and the rest were made up by colonoscopies, largely EUS and ERCP, with just a handful of each of those more advanced procedures. And so this exceeded the previous high set during REW 6 in 2023 by 89 additional procedures. Importantly, this growth occurred while spanning 7 hospitals nationwide, reflecting both increased demand and improved operational capacity. Taken together, these findings suggest that Rwanda's endoscopy infrastructure continues to expand in both scale and reach. Interestingly, we also observed substantial expansion in anesthesia-supported care. And I want to be clear that the anesthesia-supported care for the cases that were performed is all Rwandan provided. It's all provided by our Rwandan colleagues. And during REW 8, 762 procedures were performed with anesthesia support, representing 65.8% of all cases. This compares with 46% during REW 6, an increase of 19.8 percentage points. We're at a GI conference. Why am I talking about anesthesia? Well, expanded anesthesia access enables more complex, higher acuity, and better tolerated procedures while improving patient experience and procedural efficiency. These findings suggest growing multidisciplinary capacity not only in the gastroenterology realm, but also in anesthesia, in nursing, and peri-procedural teams. And we also expanded our therapeutic endoscopy capability. And in doing so, the advanced interventions that were performed were 12 snare polypectomies, 6 sphincterotomies, 5 biliary stents, 3 stone extractions, and additional interventions included several variceal ligations, esophageal dilations, and gastric dilations. These procedures are especially important because they move systems beyond diagnostics alone toward definitive treatment. This expands access to higher acuity GI care locally and may reduce dependence on Rwandans having to be referred to outside areas and countries for more specialized care. And most importantly, it reflects growing in-country therapeutic expertise. We also identified a substantial burden of untreated gastrointestinal disease. And so these are findings among abnormal endoscopic exams. And so among our abnormal EGDs, 65% of those abnormal EGDs showed gastritis, 48 showed esophagitis, 11% showed a hiatal hernia, 7% showed gastric ulcers. Among the duodenal findings in EGDs, these are also, once again, abnormal EGDs, 49% of those abnormal exams showed ulceration, 37% showed duodenitis, and 4% showed stricture. And among our abnormal colonoscopies, we saw 39% with hemorrhoids, 19% with polyps, and 18% with masses. These findings reveal significant unmet need for GI diagnostic, therapeutic, and preventative care, including earlier cancer detection, ulcer management, and colonoscopy access. In conclusion, REW8 achieved the highest procedural volume to date while simultaneously expanding anesthesia-supported care and therapeutic capabilities. The initiative also identified a substantial burden of untreated GI disease, underscoring the need for continued diagnostic access. More broadly, Rwanda Endoscopy Week demonstrates that sustained local and international partnership can support meaningful in-country growth, and it offers a replicable framework for other low-resource settings seeking to expand specialty care through training, systems development, and collaborative investment. Rwanda Endoscopy Week provides a blueprint for national GI capacity expansion. With gratitude, we thank the Rwandan Society for Endoscopy, the University of Rwanda, the Rwandan Ministry of Health, GI Rising, participating hospitals, all REW8 collaborators, and most importantly, the patients and families we serve. Thank you very much, Urakoze. I'd be happy to take any questions.